The Occupation Presentation by Nadeem Elmahroukey. The occupation that I chose was to be a surgeon or a physician. The reason I chose to be a surgeon or physician was because I was intrigued by how the human body works. Some of a surgeon's duties are to take a patient's medical history, update charts and patient information to show current findings and treatments, order tests for nurses or other healthcare staff to perform, review tests results to identify any abnormal findings, recommend and design a plan of treatment, address concerns or answer questions that patients have about their health and well-being. Help patients take care of their health by discussing topics such as proper nourishment, hygiene. In addition, surgeons operate on patients to treat injuries or diseases or deformities. The job requirements for being a surgeon is you must have experience. Extensive skill, knowledge, and experience are needed for these occupations. Many require more than 5 years of experience. For example, surgeons must complete 4 years of college and an additional 5 to 7 years of specialized medical training to do their job. Education. A bachelor's degree is the minimum formal education required for these occupations. However, many also require graduate school. For example, they may require a master's degree, or some require a PhD, MD, or JD law degree. Training employees may need some on-the-job training, but most of these occupations assume that the person will already have the required skills and knowledge, work-related experience, and/or training. Wages for physicians and surgeons are amongst the highest of all occupations. According to the Medical Group Management Association Physician Compensation and Production Survey, median total compensation for physicians varied with their type of practice. In 2012, physicians practicing primary care received a total median annual compensation of $220,942, and physicians practicing in medical specialties received total median annual compensation of $396,233. Here are some more graphs. Some pros of being a doctor is that despite the changes taking place in the professional applications of medical schools, rose to an early all-time high in the late 1980s and early 1990s, and while they have stabilized in the last 10 years, schools still receive 3 to 5 times more applicants than they have positions for. Certainly one reason for this is that medicine is still among the highest paying and most prestigious professions in the country. The following chart shows us the average salary of U.S. physicians. Some cons of being a surgeon is that the malpractice insurance has skyrocketed in the wake of many lawsuits aimed at specific physicians, hospitals, and the field of medicine in general. Distraught families no longer blame God or fate for the death or disability of loved ones. They blame doctors who treat them. As in any profession, there are certainly some who deserve such blame. However, careful, caring physicians are more and more often finding themselves fighting legal battles for their right to continue practicing in what their other profession can a simple mistake cost a life. Doctors are not heartless, their failures weigh heavily on them, yet neither are they perfect, and we often expect too much from them. Not only would this job help people grow into their community, it would help them understand and be able to socialize with their community. Job prospects should be good for physicians who are willing to practice in rural low-income areas because these areas tend to have difficulty attracting physicians. Job prospects also should be good for physicians in specialties dealing with health issues that largely affect aging baby boomers. For example, physicians specializing in cardiology, radiology, and radiology will be needed because the risks for heart disease and cancer increase as people age. In 2022, employment for physicians and surgeons is projected to grow 18%. faster than the average of all occupations. Job growth will occur because of the continued expansion of healthcare-related industries. The growing and aging population is expected to drive the overall growth in the demand for physician services as consumers continue to seek high levels of care that uses the latest technologies, diagnostic tests, and therapies. Some medical schools are increasing their enrollments on the basis of a perceived higher demand for physicians. Although the demand for physicians and surgeons should continue, some factors will likely reduce the growth. New technologies will allow physicians to treat more patients the same amount of time, thereby reducing the number of physicians who would be needed to complete the same tasks. I hope that my presentation gave you a clear image on what I will choose to be, the surgeon.